Hello, and welcome back to the Jefferson Enterprise Preoperative Education Series for Bariatric Surgery. This is the final presentation in the series and will detail what you can expect at hospital discharge and beyond. After you've had your surgery and are recovering, naturally you want to get back to the comforts of your own home as soon as possible. For the majority of patients, discharge occurs the day after surgery. In fact, most patients can expect to be discharged mid-morning to mid-afternoon, so be sure to have your ride ready and available to pick you up in that time frame. Everyone is different, and there are some occasions where an extra night's stay is needed. The reasons for this are varied. The type of surgery you have may make it more likely for you to spend an extra night. For example, a revision surgery is a bit more complex, and therefore it may take a bit longer for a patient to be ready to go home. When discharge planning, regardless of the type of surgery you have or how long you stay, there are discharge criteria that need to be met before you can be discharged home. This is so that you are set up for the best chance of success at home and to prevent you from having to come back to the hospital with a complication. Pain should be adequately controlled before you go home. This means that you tolerate oral pain medication and that it works to control your pain to an acceptable level so that you can continue to be active and drink your fluids at home. Nausea should be improved with medication so that you can continue to drink fluids. You will receive a prescription for anti-nausea medications to take at home if needed. You have to be able to tolerate your stage 1 diet and drink adequately. This means that you are able to tolerate fluids for approximately 4 hours without significant nausea or vomiting, and that you can tolerate at least 3 to 4 ounces of fluid per hour. This is very important because if you are able to do this, then you will be able to drink 48 to 64 ounces per day, which is your daily hydration goal. All medical conditions, such as high blood pressure or diabetes, should be stable. When these criteria are met, you will be discharged. You will receive prescriptions for pain medication and anti-nausea medication. If you need to take a blood thinner after surgery, this will also be prescribed for you. If any adjustments were made to any of your chronic medications, or if you are started on a new medication, a new prescription will be provided as well. Home health care is available if needed, but this is only for patients who have had a prolonged hospital stay or a complicated postoperative course. You can also expect a follow-up phone call within a day or two of your discharge from the hospital. The purpose of this is to make sure you are recovering well at home. Once you are home, you will continue to do the things that prevent complications while you recover, as discussed in the previous presentations. This includes frequent walking and purposeful movement each hour that you are awake to prevent blood clots, using your incentive spirometer to do your breathing exercises 10 times every hour for 1 to 2 weeks after surgery to prevent pneumonia, and sipping fluids all throughout the day to prevent dehydration. An important point to remember is that you should continue to improve and feel better after you are home, even if it's a tiny bit each day. If you are feeling worse and experience new or worsening symptoms at home, this is something to call your surgeon's office about right away. Sometimes during your recovery, you may encounter minor problems. Remember that nausea may still occur at home because your diaphragm, which is the muscle under your lungs that helps you breathe, is tight and swollen after surgery and takes some time to heal. You are also learning to eat and drink again, and it can take several weeks before you begin to feel comfortable. To that end, some behaviors that can cause you to feel nauseated or even vomit are eating too fast, not chewing food well enough, eating too much at a time, advancing your diet too quickly, or drinking liquids while eating meals. If you experience nausea or vomiting, think about if any of these things could be the cause and then make the appropriate adjustment. However, if you are still experiencing nausea or vomiting after stage 1, please contact your surgeon's office. Constipation is another problem that can occur. Bear in mind that your bowel habits will likely be different in the weeks after surgery. Drinking enough fluids and walking frequently will help to prevent this. However, if you become constipated, you can try a mild stool softener such as Colace or a mild laxative such as Miralax. These medicines are available over the counter. You can increase your fluids and continue to move frequently. Some pre-made protein shakes contain additives that may cause constipation, so you may want to stop using these for a time if you do become constipated. Female patients may experience changes in their menstrual cycle after surgery. This is normal. As a reminder, female patients should avoid getting pregnant for at least 12 to 18 months after surgery. You should take pain medicine, anti-nausea medicine, and blood thinner medicine if it is prescribed to you as directed at discharge. If you have any questions or concerns about these medicines, be sure to contact your surgeon's office. It is important to remember that NSAIDs, which stands for nonsteroidal anti-inflammatory drugs, and aspirin-containing products are generally prohibited after bariatric surgery. These medicines include ibuprofen, which is the generic name for Motrin and Advil, naproxen, which is the generic name for Aleve, aspirin, Excedrin, Pepto-Bismol, and Alka-Seltzer. Please discuss with your surgeon if you think you may need to take one of these medications. If you have any medication questions, please do not hesitate to reach out to your surgeon's office. In addition to any questions or concerns you may have, there are specific symptoms that you should call your surgeon's office to report. These are a temperature above 100.4 degrees, increase in pain, swelling, redness, or drainage around your incision sites, a heart rate sustained above 100 to 120 beats per minute, increased belly and shoulder pain, increased nausea, persistent vomiting, or inability to keep liquids down. Report these to your surgeon's office and they will give you instructions on how to proceed. You should call 911 if you experience sudden unrelieved chest pain, sudden shortness of breath or trouble breathing, sudden trouble walking, speaking, or seeing, confusion or disorientation, a severe allergic reaction, or sudden severe pain. If you need to come to the emergency department, please try to return to the emergency department of the hospital where you had your bariatric surgery. Follow-up is critically important to your recovery and to your long-term success. The bariatric surgery team wants to ensure that you stay healthy and meet your goals throughout your life. Please follow the follow-up schedule provided by your surgeon. After the first year of follow-up visits, you should have a visit each year for a checkup and to monitor your labs. This is so important in keeping you healthy. There is also a possibility that other issues related to your bariatric surgery may arise, such as acid reflux or pouch stretching, for example. And it is important to follow up on any of these things with your bariatric surgeon. Please reach out to your bariatric team if you experience any health changes, difficulty maintaining your diet, weight plateaus, or weight regain. The team is here to help you. Lastly, stay connected to your bariatric surgery team and the community of patients. This program offers support groups and patient engagement via a private Facebook group. Having a community of support is extremely beneficial to long-term success. Please know that you can always reach out to your bariatric surgery team, whether you are 5 days post-surgery or 5 years. Jefferson's mission statement is "We improve lives," and all of us in the Jefferson Enterprise Bariatric Surgery Program thank you for allowing us to help improve yours. Thank you for watching the Jefferson Enterprise Preoperative Education Series for Bariatric Surgery. Wishing you lots of success in your journey as you achieve your health goals. Thank you for choosing Jefferson.